Good afternoon. We are now live on YouTube. Welcome to Path Tuesday Table Talk. My name is Hala Dura. I am the founder of Path, Patient Advocates Transforming Healthcare. I'm also a patient family engagement consultant. Welcome to our weekly talks and conversations around everything and anything healthcare, and our Empowering Partnerships series that we are happy to really kick off this winter and bring guests that can really talk to us about empowering partnerships and supports and various topics that we don't necessarily always touch upon in healthcare, but certainly are very important to patients, families, communities, and for healthcare transformation. I'm really excited to have my two guests today, John Novak and Dana Dayton of Inspire, both of whom I really have great admiration and respect for. And certainly I'm very excited to welcome them today and have this great conversation around peer-to-peer support, building a social network for health and inspiration. Just a reminder to those of you who are joining us today on YouTube, if you are signed in, you are welcome to send your questions, and hopefully we can get to some of those during our conversation today. I also wanted to remind our audience about PATH and who we are and what we represent. We are a diverse and passionate coalition of independent healthcare thought leaders who seek to transform healthcare through integration and advancement of patient, family, community, and caregiver engagement. Through our coalition's advocacy, experiences, and expertise, we serve as trusted partners in the quest for a more equitable and community-centered healthcare system. Again, I'd like to welcome Dana and John today. I just wanted to share with our audience a little bit about both of them. John Novak is the head of patient engagement and senior director of communications at Inspire. John oversees patient engagement and communications for Inspire. He served on the Association of Healthcare Journalists Board of Directors and was also an officer of that group. A former journalist, he was a group publisher at HC Pro, a healthcare regulatory publishing and training company. John is a volunteer committee member for the Society for Participatory Medicine and the nonprofit advocacy organization SCAD Alliance. He has a bachelor's degree in psychology and a master's degree in journalism. Welcome again, John. Dana is an accomplished professional with experience in corporate marketing, publishing, and partner and project management. After 20 plus years at National Geographic, she is now a senior project manager at Inspire, the largest network for health. Outside of work, she is focused on healthcare advocacy and policy, two of my favorite things, Dana. She serves as an executive board member of ECAN, is a patient representative on the locally advanced esophageal cancer guideline panel for the American Society of Clinical Oncology, a member of the NCI Patient Advocate Steering Committee, and NCI Esophageal Gastric Task Force, sorry, got tongue twisted there, and serves on the Esophageal and Stomach Cancer Project Patient Family Advisory Committee, a project led by the Broad Institute of MIT and Harvard. After many years as a caregiver to family members and surviving her own health crisis, Dana thrives on improving and empowering patient communication and connections to driving better healthcare outcomes. Welcome again, Dana. So I wanted to kind of start our conversation today, and first I'd like to have Dana kind of speak into our conversation, but I know for so many, peer-to-peer support is so much more than the words that we could probably express today. It has so much levels of different meaning for those individuals who engage in networks that really support peers as they share their journeys and their healthcare experiences, no matter what those experiences may be. I do remember as being a parent of a child who's been through many, many different health conditions and issues. One thing that always stood out to me, and I will never forget it, is once she had her liver transplants, and she had two within the span of 2 days. As soon as she started to recover, I remember someone coming to the room and dropping, I would say, a 3-inch ring binder on the bed and said, "Here you go. This is all you'll need to know to take care of her." And I remember just staring at the binder and I was like, oh my gosh, what am I going to do? And thinking to myself, I wish I had someone that's been through this that I could talk to, that could share with me what I should expect, how I should feel, or maybe even let me cry on their shoulder when things got too tough. And so I have always been such a big advocate for peer-to-peer support, and I can't wait to hear more about what both of you are doing with it, Inspire, and all the amazing work that you've done and that's ahead. So Dana, why don't you kick us off and tell us a little bit more about the importance of peer-to-peer support and how Inspire has been really a key component of really bringing together those partnerships.
Thank you, Hala. It's such a pleasure to be here, and the admiration is mutual. I just love your work, and I'm so glad that you bring these issues to the forefront because we can all really learn so much from each other. So, as you know, as a mom with a child that had medical needs or still does, there's really, very few times in your life where social connection can be as important as when you are going through a medical crisis. And I think that happens for a couple of reasons because patients and their caregivers tend to feel very alone, and you need to reach out to people that can identify with what you are going through. But also, as I'm sure you learned, and as I have been through, there is often sort of a language that goes along with being that patient or that caregiver that is just so unique to the situation that you have to find the right group of people to talk to. Otherwise, it doesn't really mean anything to anybody. And in fact, I have found sometimes that even speaking to a nurse or a doctor or another provider that has not gone through the same medical experience, they can't possibly understand what you're talking about. They haven't felt the same sensations. They haven't experienced the same pain. They haven't, woken up in the middle of the night. They might be able to identify on some level, but really until you start using the same words about the same feelings and the same expectations, it's really hard to be on the same page with everybody else. And I think that's why social networks can come in, to be very, very handy. And then on top of that, on top of the educational reason, there's just also the emotional support that you're going to need. And you see that happening all over the place on networks like Inspire, but even on other networks like Meal Train, where people come together to provide food for families in need because they're going through something. And those are just great sources of hope and support for everyone involved. I think it makes the patient and caregiver feel like they can lean on people without having to ask too much. And it makes people that are contributing to a cause feel really good that they're part of something bigger than themselves. But I'll back up a little bit to the patient experience and why I reached out to Inspire when I was diagnosed at the age of 43 with esophageal cancer. At that time, I had never even heard of esophageal cancer. I mean, I knew I had an esophagus, but I didn't even know that's, a place where a malignancy could occur. And as I started to do research, I quickly learned that most of the people with the same diagnosis were much older than me. They were usually men, and they were usually people that had lived a lifestyle that was a little bit less healthy than mine, or maybe a lot less healthy. But I had, never been a drinker or a smoker or anything like that. So I didn't have any of the predispositions that would have set me up for this disease. So it was quite a surprise. And when I started trying to explain how I was feeling to doctors, they didn't understand why I wasn't having some of the normal symptoms. And the fact of the matter was, I just wasn't. But what I was having were symptoms that were still very bothersome and uncomfortable and chronic. And they were keeping me from helping my kids with homework and keeping me from living my active life. And as I started to explain how I felt on the inside, they just kind of looked at me and they didn't understand. And they also didn't have a lot of great answers on how to help eliminate some of those symptoms or at least reduce them. And so I started going online looking for help on, not only where to find care for my condition, but also to ask about some of these things. And that's where I started to put two and two together and found that when people who have the same condition start to share their experiences, there are new words that bubble up that are an articulation of what they are feeling, but often not the same words would be used by providers. And so at the end of the day, perhaps providers and patients are talking about the same things, but patients use a very different language. And that's what John was referring to earlier as the patient lexicon when we spoke before today. And I think social networks can really help surface some of those terms and phrases and things to talk about with your doctor that you may have not previously been able to put words to. So that can advance the conversation and hopefully help change the care that you're receiving and make you more comfortable. Social networks can also give you great ammunition as far as questions to ask, because people have had different experiences too, and you might be able to preemptively ask about things that could save you a great deal of discomfort or trouble down the road. So I like to look at social networks as an opportunity to just learn about a lot of different situations. Maybe some you haven't experienced yet, but there's information that you can bank for later. And you can also share your experiences and hopefully help save other people the same struggle that you have endured. So I'll stop there. I don't know if that helps to speak to what you were asking.
Oh yeah, certainly. And I appreciate, you sharing your own personal experience as well, and the importance of being able to find those connections, and especially when you feel like no one is understanding what you're sharing or how you're feeling, and to find commonality in that with others, and really feel acknowledged, right? And empowered that, wait a minute, I am feeling something that others have felt, and there are ways to alleviate it, that perhaps, for all the knowledge and wonderful support that clinicians do try to provide, they certainly don't know all the answers. None of us do, right? But being able to find those connections, I think, is so important. I'd love to hear from John just a little bit about Inspire and how the network was developed, and just give us a little bit of insight into what I think is a wonderful way for patients and families and communities to connect.
Thanks, Ella, and thanks for having us. And thank you to my wonderful co-presenter who covered and spoke probably better than I could. So I'll be kicking it back to her quite soon. Be ready. But I will be happy to talk a little bit about Inspire itself, and also in the context of social networks or peer groups for people affected by life-altering, if not life-threatening disorders. Inspire itself is a privately held company based in Arlington, Virginia, and one of the extraordinary things about it is that it's 15 years old, give or take, founded back in 2005 by our current CEO, Brian Lowe, who founded the company as the platform that it is today. We didn't roll into this through a consultancy or a data play. He and the other architects founded it as a platform for peer-to-peer support around a therapeutic area, and to connect those patients who were looking for the connections to research. And that takes the shape of clinical trial recruitment, by example, as our business model. And from that early going, and it was pretty early when you think about the age of Facebook, Twitter, Instagram. It's really extraordinary, and built up on inspire.com to now registered members of more than 2 million patients and caregivers interacting in, give or take, 220-ish groups on the community, and representing somewhere around over 3,000 conditions. And we work with all the largest pharma companies in the world. and on projects like trial recruitment, trial design, things like that. And for us, one important component and developed early on was to reach out to nonprofit organizations. Many you and our viewers know today, American Lung Association, Ovarian Cancer Research Alliance are just two who pop to mind, to be at no cost to them, the online community, peer-to-peer support, built, developed, hosted, and managed with live moderators on Inspire.com. That's a big differentiator. I suspect you and your viewers certainly ask, like, well, how is this managed, and is it mean? Is it accurate? Is it not a place that you want to be, either for the tone or the respect for people's viewpoints or anything else? If you don't have that, people will find something else, or they'll just leave, and that's a reality. Particularly those who are acutely ill and don't have a lot of time to kick the tires on an online community. If they're not finding it, they're going to go somewhere else, and we certainly learned that. And the last thing I'd say, and so there are a number of organizations, again, nonprofit organizations can have communities that can peer-to-peer support groups. Obviously on Twitter and Facebook, there are groups of different types and stripes. Certainly the chats, the wonderful BCSM for breast cancer social media is one very well-known example in our space of a community. I was on it last night, and it was heartened to hear somebody or see somebody write that, and this was a very veteran, very health literate, with it advocate, talking about how comforting it was just to be there and to see her friends, and to write and be under that umbrella that these are people affected by breast cancer, and that's a community. So one thing I think that is important to note is communities where you find it. And certainly in digital health, there are lots of ways and places to say, this is my community, even for people with ultra rare diseases. It doesn't have to be the tens of thousands or hundreds of thousands, it can be less.
So I was curious, and either, Dana or John, feel free to answer this, given the impact of COVID and certainly many folks having to quarantine at home, and the environment that certainly has changed in going into the clinics or hospitals for treatment, whatever, the disease may be. Have you seen an increase in the numbers that have been coming to the Inspire site to, find various communities, given that, we know that many health systems also have peer-to-peer support groups and such, but I'm wondering, have you seen an increase in the numbers that are coming to the site now that, those types of peer-to-peer support are not really being offered in most places?
I'll jump in, and Dana can speak to a cool research initiative that we're rolling out related to COVID and vaccine related issues. In general, yes, and again, this is I'll answer from the standpoint of kind of what we've seen and what we've felt. Certainly, and again, in a platform like ours, and the community is high risk from the jump. For either they themselves or someone in the home, a child, an elderly parent, a spouse, it would be likely familiar with the masks or isolating, and so that part wasn't. I think that wasn't all that surprising, but certainly the comradeship, we've certainly seen an increase. I think an uptick in that warmth, and that wasn't just an outlet; it might be the outlet because of that. And certainly as this has gone from last spring to the summertime to the fall to now, particularly with vaccine, you see a lot of peer-to-peer practical, how's your hospital? What's it like getting an infusion? How do I reschedule? And certainly now questions around vaccine and sarcoidosis, vaccine and lung cancer, vaccine and children. Are questions, and you see the experts because they are experts of that lived experience, particularly when you start getting into disease types or regions on those topics. So we're grateful that the community has served as such. It makes us feel proud and certainly eager to do even better when such a disaster hits the world. And we certainly see the value to many for whom it is that outlet in a number of ways now, in the way of, should I get the vaccine? Or, what's the difference between Pfizer and Moderna? You see a lot of discussions getting down to that granularity, and we expect that will continue. Dana?
Thanks, John. Yes, I'll just follow up a little bit about on our new initiative, which is it's called the COVID Vaccine Health Journey. And Inspire has decided to ask people, some of our members, questions about how they feel about the vaccine, whether or not they have had it, whether or not they want to get it, where they've heard about it, where they think they might be able to get it, just to kind of track people's responses over time, excuse me. And also, since people also often tell us about other conditions they have, it will allow us to start to put some points together and hopefully better understand if people with certain other comorbidities reacted better or worse to having COVID or to getting a vaccine or what have you. And so we're really hoping that with all of the responses we're getting, which is actually been epic for Inspire, that we will be able to expose some really interesting new learnings about how COVID and the vaccine are impacting people worldwide. Our members are both in the United States and all around the world. And by the way and rate that the answers are coming in, we are really excited that we will be able to showcase some interesting data points in the near future, which will hopefully not only be of interest to people like you and our members at large, but also be medically important and help to drive better care and treatment for COVID and people with other conditions that are impacted by COVID. So we're really, really excited about that.
I'm really excited hearing about it, because I know that's been on top of mind for, my family, and having a child who's a solid organ transplant and a bone marrow transplant and a cancer survivor, but is of the age where, she would qualify to take one of the vaccines, or however many we end up having. But certainly that's a question I think all of us have, and to be able to connect with a community and understand those experiences, I think is just phenomenal. And that data that you're going to be able to really share out to the medical community, I think is so important as well. In these last few minutes, talk to me a little bit about, and this can be, Dana and John, if you'd like to tag team on this question, it's up to you, but talk to me about, where do you see Inspire going in the future? What does that look like? Do you see, something new that perhaps you're not doing right now? Do you see the network continuing to grow in such a way that, it just is going to just keep going and going and going? How, or maybe do you see people interacting different on there? Talk to me a little bit about what does that look like, and how perhaps, we can connect more people to Inspire.
Well, I'll start and then I'll hand it off to John. We were excited about 1.5 years ago to launch our mobile app for Inspire, which is really great because it means you're not tethered to your desktop to chat with people or ask questions. What's great about the app is when you're in the doctor's office and you have a quick question, you can put it out there and hopefully get an answer in a timely way so that you can, ask your provider, or maybe even just have your anxiety reduced a little bit, because you know that other people out there are going through the same thing. They've had the scans or they've had the biopsies or whatever it is, and they can give you a little bit of peace while you are out having that taken care of. So I think that has definitely boosted the number of Inspire members, and also boosted some of the conversations and the posts that we see going on. And with other new features and offerings like the COVID vaccine survey, we're definitely seeing increased engagement. I think that that's probably the case for most social platforms during this time of the pandemic, but we're really glad that people are sticking with us, and we plan to support them as well. I'll just also add that you mentioned being acknowledged and things like that. I think, another great thing about Inspire is, that there is somebody out there that can validate what you're going through. And, that sometimes doesn't necessarily mean you're going to get better treatment, but somebody hears you. And that just gives you a little bit of hope and inspiration, literally. Like, you might be able to make it through that day, or you might gain a little nugget of information that will give you enough hope to make it through the next day. And you can just keep on repeating that. And before you know it, sometimes it really has changed, either the course of conversation or maybe even the course of care in a positive way.
Dana really nailed it. I'd like to talk about, when the question came out about the several tens of thousands of responses we've gotten already, the heading toward 2 million data points related to the COVID-19 and vaccine issues, be it hesitancy or desire. And that's growing, as Dana alluded to in that project. That is part of Inspire's future, certainly in a manner as we grow as a company, to be able to work with our community, and also to what we hope are to expose novel findings that can help change treatment. That's we want to accelerate discoveries in that manner, and we can. We're working on a project right now involving Pfizer and Boston Children's that has been written up, and hopefully will lead to a peer-reviewed paper sooner than later, on a certain condition and resilience as it relates to cancer survival. It was somewhat a hunch by a researcher, and a needle in a haystack type of thing. And they're in our community because we asked, and people want to be heard. But rounding back to Dana, sometimes and that's exciting, and it's exciting to be inspired for that. What we like is that we do that at the same time that we do that. Member who joins today reaches out and someone says, you are where I was 3 years ago. That can be everything. And that is a power of social network. And we are in a great position to ensure that is the bedrock as we grow as a company, and be able to identify through data and open sharing the component that might seem like buzzy, but when it gets down to it, that lady who's speaking to another lady and feels connected, perhaps in our ovarian cancer community, and that they refer to each other as Teal sisters, that's everything.
Yeah, I mean, I love the way you both framed that, and Dana, I felt that when you said, you hear me, you see me, you validate me, and maybe that one little nugget, right, gets me through that day. And I think that's the power of the connections that you all are creating through Inspire. And that's the power of peer-to-peer support. And so I'm so grateful for this conversation today. I know I could probably talk hours with both of you, but sadly we've gotten to the end of our time together. But I wanted to thank you both, John and Dana, and Inspire, for the work you're doing, connecting others and supporting others on their health journeys. And like Dana said, it's that small nugget that can make such a difference. And so I'm very appreciative to both of you for sharing that with us today. And thank you to our audience for joining us. We will not be having a table talk next week, but we will be back on Tuesday, February 23rd, and we'll be posting information soon about that talk. But thank you so much to those of you who joined us today, to our YouTube audience. I see some notes in the Q&A saying this was a great discussion. So just wanted to share that back to you and Dana and John. And so thank you so much for joining us, and hope you can join us again next week. If you haven't subscribed to our channel, please do, and then you'll get automatic notifications when we've posted our talks or when we're live. So please join our community as well. Thank you guys so much. And Dana and John, if you could just hold for a few seconds while we close the YouTube stream, and we'll see you all next week. Thank you so much. Bye-bye.